We have an important story to tell you about a major health and fertility issue for women. We're talking about uterine fibroids, non-cancerous tumors that may cause pelvic pain, bladder problems, and can affect fertility. Bettina Celestin was diagnosed with 3 small uterine fibroids in 2016. Her then doctor told her to watch and wait. 5 years later, she had fertility problems and became a patient of Dr. Shirazian, a gynecologist and director of NYU-Langone's Center for Fibroid Care. Last year, Bettina became pregnant with her daughter, Eloise, just 3 months after 26 fibroids were removed. Dr. Shirazian and Bettina join us now. Good morning to both of you. I said to both of you when you sat down, I've heard this story. I've had a lot of friends who have said, oh, yeah, I have fibroids, but 26? Bettina, what did you think? 26?
I actually got to see a picture afterwards, and I couldn't believe it. It was just so big, humongous. It made sense that I had so much bloating and pressure.
Is that a common number for women?
It's actually relatively common. I think many women are counseled to just watch and wait, as Bettina was.
Right.
And then over time, these fibroids grow, and all of a sudden, there's 26, and they're huge, and she was suffering with pelvic pain and pressure.
Right.
And that's what I was going to say. When did you know that it was a problem for you, Bettina?
It was gradual. It just kept getting worse and worse and worse. When I was laying down on my back, I could see it. My stomach was just distended to that extent.
Which, again, so many women have had.
Yes.
Right.
And they just sit there.
A lot of women, visibly will even look pregnant from fibroids.
I did.
Pregnant,
Yeah.
right?
Yeah.
And people come up to them and say, oh, when are you due? Or people tell me stories, others give up the seat on the bus for them. It's very, very difficult, especially if you're suffering with fertility issues and you have these large masses, for it visibly to look so large.
Yeah.
So what causes fibroids?
Fibroids are actually benign, as you said, so they're non-cancerous. We think that they're caused by a number of things, but some of the factors that contribute to fibroid growth are genetics.
Okay.
We think there's some environmental factors. Estrogen feeds the growth. So in some women, this estrogen is sort of taken up by these tumors and they grow to be quite large. And it affects so many women. That's the other really important part. 70% of all women are affected by fibroids. So in any room with female patients, you're going to find many that have fibroids or who have had them. Right. So it's really a universal and very, very important topic.
And Bettina, how did it affect your fertility?
I actually had a miscarriage prior to having Eloise in 2021. And when I went to the emergency room, the doctor thought I was maybe 3 months pregnant, and I was only 8 weeks at most. That's how pregnant, my belly was distended so much.
And what type of info did you get back on why you had the miscarriage? What did they tell you?
Well, they can't know for
reason
sure, but when 26 fibroids end up getting taken out of you, you have to think that there's a correlation there.
Is that common?
Yes. I mean, we think that not only, there are certain types of fibroids that are directly linked to miscarriage, like the ones that are submucosal or in the lining of the uterus.
Right.
But also just the sheer number. I mean, think about local inflammation and, pressure on the uterus. We definitely think that many fibroids can contribute to loss, to miscarriage.
Now, there are higher rates of uterine fibroids in Black women.
Yes.
Why is that the case?
Yes. Well, we know that there's racial disparity. We think that there is some genetic piece to growth.
Okay.
But honestly, we need so much more research. And at the Center for Fibroid Care, we're dedicated to sort of studying these racial disparities. And also, we're looking at things like environment. How does lifestyle and supplements and nutrition contribute to recurrence risk for fibroids? And we're smiling because Bettina had wanted to be in our study, our life program, but then she got pregnant.
Well, it's a good problem to have.
Yeah.
Both of you, tell us, doctor, you start first in terms of if you were starting this journey again. Well, Bettina, actually, I'm going to start with you. If you were starting this journey again, what questions would you ask differently? What advice would you give to somebody who was in your position at the very first time you heard about fibroids?
Do not wait. Just get them out. They're only going to get bigger. It's going to become a bigger problem. Just go ahead and get the surgery.
Yeah, I actually think that's exactly the right message. You want to go in early You want to know your options, right? So that's another really important part for women across the country because, you know, I like to think we have lots of options here in New York City, but maybe in other parts of the country, women aren't aware of all their choices. Right. So the earlier you go in with fibroids and the earlier you know about them, the more choices you'll have that are going to be more minor choices, you know, not a big surgery.
Can we please take a look at your daughter? Because I know she's in the green room, and she is just adorable, Eloise. And you couldn't be a part of the study because you did get pregnant.
Right.
But I'm curious, for women that do have fibroids, have them removed, how common, doctor, is it that they then have fibroids again and may have trouble getting pregnant?
Very common. 70% recurrence risk over your lifetime. So very, very common that they will come back, very likely, which again is why we need centers. Like, again, we have a center because it's going to provide longitudinal and continuity care. So you can keep coming back to us. We do studies, we are gonna follow you, we're gonna keep an eye on the fibroids and that recurrence risk. So that's why it's so important, because we know they come back.
And we have to talk about it. It's another one of those topics that I say with my friends, with other women, we gotta talk about it so that we all know, so that we can tell our friends.
Yes.
Right.
And
Real
please,
quick, the best part of being a mom.
That smile, did you see that?
Hey, your smile's pretty good, too.
Yeah.
There it is, right there. Bettina Celestin and Dr. Shirazian, thank you so much for joining us.